suffer from lower back pain? Poor lifestyle choices like smoking, lack of regular exercise, bad food habits, incorrect posture, and many others may be to blame. The pain you feel in your back is most oftentimes caused by having what's known as a slip disc. A slip disc is basically a bulge on one of the discs that are between the tiny vertebrae in your back. Poor lifestyle choices and back trauma are the primary reasons for this condition. When the disc bulges out far enough to press on the nerve, it causes pain, sometimes more severe than others. Pain radiating to the hips, back of the knee, heel, and toes are all pretty common. If you're suffering from lower back pain, the bottom line is that you just cannot neglect it any longer. Good chiropractic care will help you finally find the relief you need and live the pain-free life you deserve. We have years of experience and thousands of satisfied patients. We would love to reduce your pain and have you be our next happy patient. Contact us today.
Tell me what happened at work. You work in a hospital, right?
Mm-hmm.
And what happened?
I was lifting this patient in the bed that was like dead weight. He was young and he couldn't move, and he was about 250 pounds.
250 pounds?
Yeah.
That's a heavy guy.
And I had help, but it was like I had to lift him up in the gurney, over, pull him, and I didn't feel anything snap. It's just at the end of the day my back started hurting.
Really bad. What was the scale level of pain, 1 to 10?
After work, probably about a 6 or a 7.
And then did it get progressively worse or it stayed the same?
Yeah, it got worse. I couldn't sleep. I was having pain in at that time I felt it in my left side, but you said it was my right that was out.
The right one was out, yeah. I'm going to check again today. And how long after the injury before you came to my office?
About 2 weeks.
2 weeks, so you waited 2 weeks and it was getting progressively worse up to the point that you couldn't take it anymore.
Yeah, I couldn't take it. I wasn't sleeping well. I was really uncomfortable.
So you were here last Wednesday or last Monday?
I was there on
in my
I
office.
think Monday.
Monday?
Because you were there on Tuesday and not on Wednesday.
Yeah.
And then I said I would try to come back on Friday, but we were just too busy.
So after that, after that first visit, how was the percentage of improvement you had?
I felt it. I felt better, like 65%.
Okay.
And I was off last weekend.
And then you got busy on Friday. You couldn't make it.
Yeah.
Now you're back to where you were, or less than what it was.
It's less pain, but it's less. It was on this side that was bothering me. Now it feels like it's this side, and it's, it really bothers me.
Okay, let's take a look. See what's going on today. Okay, bend forward, please. Back. Forward again. Okay. Stand up. Please face the window and march in place. Stop. Okay. Alright, so go ahead and align your stomach face down, please. I'm going to adjust your back first. Take a deep breath in. Breath in. Breath in. Okay. Go on your side, please. Face me like you sleep on your side. Okay, keep this leg straight. Goes here. Give me your right hand. So pelvis here is out. Relax your shoulder. Okay. Sit up. Move to the left, please. Okay, relax. Listen. Okay, let's adjust the other side of your lung. So this was I adjusted the right pelvis. Now I'm gonna adjust the left lumbar spine.
Lay
Go
down.
ahead, yeah, lay down.
So do I use ice?
No, heat.
Heat?
Right now you're in chronic stage. Ice, you want to use ice in the first 72 hours after you hurt yourself, but you're way past
Right.
that time. So remember I gave you the Epsom salt?
Mm-hmm, I've been doing.
Okay, okay. Relax your shoulder. Okay, good. Stand on your feet.
Oh,
You know what? How does it feel?
wow. It feels okay.
Okay. Look straight. Your pelvis was really out. Okay. What was the worst position that you did that was hurting you?
I don't know.
Everything was hurting?
Everything was hurting.
Okay.
So how long is it gonna take till I get, feeling better? I mean,
Well, you usually, you haven't been here for a
I
year.
know I come periodically.
Yeah, but maybe this time plus you waited for 2 weeks.
Mhm.
I would say several sessions. I mean, because you've been getting care in the past. But then last time before this time was six months ago, which is quite a bit.
Mhm.
I know you get busy, but with your line of work, you probably wanna start committing yourself with coming like once a month for maintenance.
Maintenance.
Yeah,
Okay.
because
Yeah, 'cause I felt like I was doing good.
yeah,
I mean,
until you're not.
no, before this happened.
Yeah.
I mean, I was telling Gail I went to a spa
Uh-huh.
in January, and I had all this wonderful treatments, and then a week or so later, that's when I hurt.
Yeah.
You know,
Well, you gotta be careful. You're lifting heavy patients, so.
I always have help, but it was just like, just this constant. And I use good body mechanics,
Mhm.
but it's like, when you're constantly pulling up, pushing, pulling,
Yeah. Well,
it's like a strain.
if you can make it here on Friday so we can finish it off, that would be great.
How late are you here on
I'll be here
Friday?
until 7.
Okay,
Okay?
okay, I'll be here.
Okay.
I'll try to make it.